Okay, are you all ready?
Yes, sir.
Okay,
Yes,
then
sir.
we start. So we are going to start the webinar today. The topic of today's webinar is informed consent, what, when and how. I'm sure you have gone through it और सबसे पहले मैं पूछना चाहता हूँ कि can somebody tell me what is the difference between consent and informed consent? What is the difference between consent and informed consent? Who will tell me?
The informed
Okay,
consent.
Vikas. Yeah.
Yes, sir. So informed consent is a person who already knows about the pros and the cons of the surgery.
Yeah. But if he does not already know, then what?
Sir, in
If
that
he already
case, okay,
yeah.
that case the doctor has to provide the information.
Very good. Yeah, that's very important because in informed consent, the most important aspect is that the person giving consent should be well informed of the details, the relevant details, the benefits and the risks. So in a healthcare setting, usually the patients are not already knowing the things. So the doctor is duty bound to inform them. Okay, so we are starting with a good start. Vikas has given a good answer. So consent basically is a meeting of minds between two or more individuals. Meeting of minds between healthcare seeker and the healthcare provider. You would realize that it is different from contract. Consent is different from contract because here the two parties are unequal. In a contract, both the parties are on equal terms. Mute karo. In a contract, both the parties are on equal terms. In a healthcare setting, since the parties are not equal, the agreement between them will be a consent rather than a contract. Unmute karo. Now, who will tell me the role of doc? Okay, mute karo. See, the patient must have the requisite information to make an informed choice. In a healthcare setting, the onus of providing the requisite information to the patient is on the treating doctor, just as Vikas had told in answer to the question. So this providing the information, this requisite information constitutes the foundation of the consent process. Now, what is the requisite information that a doctor needs to tell to the patient during a treatment? These are listed here in this slide. Nature and gravity of the illness, plan of management contemplated, possibility of extension or abandonment, different alternative options including no treatment with their pros and cons, expected benefits and possible and probable risks, estimate of expenses, estimate of hospital stay and period of disability if any, and any other doubt, query or clarification from the patient or his family members. That means opportunity to ask questions. Now, this shows the essential prerequisites of a valid consent. There should be requisite knowledge, that is, it should be informed. It should be given by a person competent to give it, that is, an adult, conscious, sane, not under the influence of alcohol or sedating drugs, and it should be voluntary, that is, not made under any coercion or pressure or incentive. अनम्यूट करो. Now, who will tell me the role of documentation? Can we have a valid consent without signatures on a consent form? Who will tell me this? Okay, Prashant, you tell me.
Sir, no, signature on consent form is must.
Is a must. Okay. Now, Prashant, listen to the question carefully. Will such a consent be valid if the consent form is not there?
Sir, I think it will not be valid.
Okay, I will explain. Can you see this pyramid here in the slide?
Yes, sir.
You see, the base or the foundation is formed by the discussion. You see the broad base or the foundation of this pyramid, that is constituted by discussion. So there has to be a good discussion between the doctor, the caregiver, and the care seekers. And the next most important thing is the decision by the patient. After he has thought about it, after he has had a discussion with his family members, then he takes a decision. Once the decision has been made by the patient, that means the consent process is complete. So, medically speaking, the consent process is complete with the decision of the patient. However, the last aspect, the documentation, is also important, although not as important as discussion and decision. This documentation thing is mainly a legal component of the informed consent. This will be relevant only if there is a dispute. Otherwise, it is not important. So, have you followed this?
Yes, sir.
Okay. I see Nitya's hand. You want to ask a question, Nitya? What do you want to ask?
Actually, in case of family planning, he was to take the decision.
Can you ask the question again? You are not clearly audible.
In case of family planning,
Yeah.
he was to take the decision. It is a suppose family planning, the lady wants her to see, but the husband is refusing. In the
Yeah.
case, what?
Yeah, it's a very good question. In fact, a brilliant question. You see, family planning operations cause permanent sterilization. Yeah. Okay, can you listen? You see, Nitya has asked a very good question. Family planning operations, they you must realize they cause a permanent sterilization, and its consequences they affect both the partners. Secondly, it's not an emergency operation. So under these circumstances, the operation should be postponed. Give them some time to discuss and decide, and then if they arrive at a consensus, fine. If they still cannot reach a consensus and the lady insists on sterilization operation, we have to respect her decision. Okay?
Okay, thank you, sir.
म्यूट करो। So, म्यूट नहीं हुए ना, म्यूटेड है। Now, when do we need to take consent? When we are asking personal or intimate questions, when we touch the patient, for intimate physical examinations, for investigations and procedures which have a significant potential for risks, high-risk situations, extension or change of procedures, refusal of professional advice which could result in adverse situations, statutory consents, end-of-life situations, and proxy consent. There are some special consents which sometimes need to be taken, like high-risk admissions and high-risk surgery, removal of limb or body organ, risk of DOT, anticipation of multiple admissions and surgeries, refusal consents, LAMA consent, statutory consents, clinical trials, and HIV testing, where you need pre and post testing counseling. As far as types of consents are concerned, they may be oral or written, may be implied or explicit. Implied consent means there is presumption of consent. It is presumed to be there. As for example, history taking and physical examination on a patient who registers himself in the OPD, or explicit consent, that means it has to be sought specifically, as in intimate physical examinations or any procedure which has the potential to cause serious discomfort, disability, injury, complication or death, or which is likely to cause extra hospitalization and cost. Surgery without a valid consent would legally amount to assault by the doctor on the patient under criminal law, deficiency of service under civil and consumer law. Now, extension of procedure is another very important aspect which is rather poorly understood by many doctors and surgeons. See, if during a procedure an additional procedure is deemed necessary, do it if specific consent has already been taken from the patient. Take the consent from the proxy if proxy has already been appointed by the patient. Conclude the procedure, allow the patient to become competent to consent, discuss the details with him, and perform if he now consents. However, for a life-saving procedure, all above can be ignored. How should the consent be taken? Develop a culture of involving the patient in practically all decision making by proactively explaining relevant details, answering their queries. If required, explain with diagrams, pictures, models, videos, etc. And never hesitate to permit second opinions. Discussion should be done by a responsible person, preferably the treating physician. Give them time to think, discuss and decide. In case of urgent decisions, explain the urgency and mention in records. And in cases where explicit written consent is required, complete the documentation. Now, as we examined this pyramid earlier, documentation is only a culmination of the consent process. The main fundamental base of the consent process is the discussion, followed by decision, and it is culminated by a documentation. Now, coming to the documentation of consent, it should be a properly drafted document in the language that the patient understands. Avoid technical words. It should be procedure-specific consent document. Specify the potential risks with respect to this patient. In case of printed documents, important parts should be handwritten or signed by the patient. Besides signatures, name, date and time of the patient, signatures of witnesses and the person who has discussed the procedure details with the patient are important. Signatures of translator if used, should also be there. There should be no blank spaces. Surgery and anesthesia consent should be taken separately. I'll take up the questions after the presentation, so just have some patience. Now, should consent be reviewed? If significant time has elapsed between the consent and timing of the procedure, consent should be reviewed. Secondly, if material changes have occurred in the circumstances of the case, the consent should be taken again. Now, can consent be withdrawn? The patient has a right to withdraw the consent any time after giving it. Patient can give conditional consent. The patient can seek more time to think, discuss, and decide. And having given the consent, he can withdraw it any time after giving it. Now, what is therapeutic privilege? Doctor has the privilege and in fact a duty to provide the necessary treatment even without any consent when the situation is life-threatening and a life-saving procedure is needed. The patient is not in a position to give a valid consent. There is no relative or guardian available. In all these situations, the doctor can go ahead without the consent. Also, in persons suffering from a notifiable disease, prisoners, examination under court order or on the request of police under section 53(1) of CRPC, no consent is needed. So in conclusion, let me emphasize on certain points. Our relationship with the patient today is more contractual than fiduciary. Fiduciary means based on trust. Patients today are much better informed of their rights and are not willing to accept adverse outcomes as the will of God. Society in general and the consumer courts in particular have a prejudice in favor of the patient or consumer, even though the courts try to balance the interests of all concerned. We need to take all aspects of informed consent seriously. Proper communication and proper medical records are the most important measures besides a proper treatment to prevent litigation. Proper documentary evidence and the expert evidence besides a dedicated lawyer and always analyze and present the facts are the most important measures for succeeding in such a litigation. I hope you have understood the different aspects of consent. I'll first take up the questions from those who have raised their hands. There is a question from Prashant.
Yes, sir.
Yeah.
Sir, if the consent form has not been signed or is lost, and the surgery has been performed, then patient, if patient complains that the operation has been done without his consent, then how can a doctor defend himself?
Oh yes, it's a difficult situation. I agree. Nowadays you see a lot of litigations where these kind of complaints are alleged. See, in such a situation, still the doctor has a chance to defend himself. Say during the course of discussions with the patient, or when the patient had given his decision for consent orally, if there were other persons, maybe other relatives of the patient or members of the staff of the hospital, another doctor maybe, if they were there as eyewitnesses, their evidence can be presented before the court. Or sometimes there may be some circumstantial evidences, like for example, if the doctor had asked for a unit of blood as a precaution, or payment of say operation fees before surgery, and if the patient has arranged that unit of blood and has submitted that fee, so this will imply that the patient was agreeable to the procedure. I agree it's a very difficult situation, but still under certain circumstances the doctor can defend himself. So in fact, there lies the importance of documentation. If you have the documented informed consent with signatures of the patient and the witnesses, then the problem is not there. That is the easiest and the safest form to defend oneself. Have you followed what I said? Okay.
Yes, sir.
Yes, Vikas, yes, you want to ask a question?
Yes, sir. My question to you is, if a surgeon finds during a surgical procedure that the procedure needs to be changed due to the new finding, then what should be done?
Yeah, that finding was not there when the discussions took place before surgery, and you find a new finding. This is again a very, very good question. You tell me, what is your opinion? What should be the answer? Because you please tell me.
Yeah. Yes, sir. Doctor, whatever the doctor thinks is right, sir. He always thinks in the interest of the patient. He should decide himself, sir.
Okay, yeah. I think you are living in the olden times when the relationship between doctors and patients was more based on trust. The patients usually trusted the doctor, and the doctor did not have to ask too many things from the patient. He could take decisions in the best interest of his patient. See, even today, you are correct medically. Medically, there is no problem. You had a discussion with the patient on the basics, and during surgery, you find something tricky, something which was unexpected, and you have taken a decision. Medically, you are correct. But legally, that is not the correct approach. Have you read the Samira Kohli judgment?
No, sir.
Hello? Yeah.
No, sir.
Okay. These judgments are given in the third term. You will read these judgments. These landmark judgments are available on the e-library also. Maybe today, after having listened to the informed consent lecture, if you read this Samira Kohli judgment, you will have all your concepts cleared. As far as your question is concerned, see, the recommendation from the Supreme Court of India is that the surgeon should close the operation, let the patient come out of anesthesia, then discuss the details with him, and if the patient agrees for that extended procedure, then you do the operation again, go ahead, go in and do that extended procedure again. But if the patient is not agreeable to that extended procedure, of course, you cannot and you should not do that. Have you understood?
Yes, sir. Sir, if a patient dies during such a procedure due to bleeding, then what should be done?
Yeah, sometimes you get a situation where there is a lot of bleeding or some complication during surgery, or something new has been witnessed during surgery which might prove to be life-threatening. In that situation, the doctor has all the privilege to go ahead even without consent. I talked about the therapeutic privilege. So this is a therapeutic privilege. In such situations, in life-threatening situations, you don't need anybody's consent. You can go ahead. But in case the situation is not a life-threatening and the procedure is not a life-saving procedure, you cannot go ahead without taking the patient's consent. Under that situation, you'll have to close down the abdomen and let the patient recover from anesthesia, discuss with him, and then ask, and if he agrees, then go ahead. I think you've given a very good question for me to respond. So any other question? Any other question from anybody? So it seems you have all understood the basics of informed consent, and I am happy with the questions that you have asked me. And in case you have any problems, any queries, even afterwards, you can always chat with me. You can always even call me up, and I would suggest summing up this consent lecture, that you must go through that Samira Kohli judgment, which is available on your e-library, and I'm sure all your concepts about informed consent will be clear, crystal clear. So good. We had a nice discussion, and thank you all. Good day.
Thank you, sir.
Thank you. Welcome.
Yes, sir.
You are currently the only person in this conference.